Hi there, this is Jonathan Ginsberg, and I'd like to talk to you today about an issue that sometimes pops up for people who've recovered from some sort of a severe medical condition, but they've undergone, whether it's chemotherapy or strong medications. They may have some residual mental health or non-exertional limitations that may not necessarily show up right away, but can show up a little bit later on that can really have some negative impacts on their capacity to work. So basically what I'm talking about is situations where you may have undergone chemotherapy a number of years ago. You may have had treatment for things like rheumatoid arthritis or lupus or some sort of a chronic condition, but the medications are very, very strong. Antivirals, things that you might have for immune system disorder or perhaps hepatitis, things like that. Even very, very strong antibiotics or medications that are designed to treat anemia. Anything that's very, very strong. What sometimes can happen is those medications can have a residual effect that can impact your capacity to think and to focus and concentrate. And you may find that you're dealing with slower processing speed or short-term memory limitations, personality changes. I've seen people with anger control issues or personality problems. They couldn't get along with other people or wanted to be alone. Used to be social, not so much anymore. Attention and concentration, obviously depression. Sometimes people get very depressed thinking about the medical, what's happened to them, especially if they've had some sort of disfiguring surgery or they realize they can't remember things anymore and it's becoming very difficult. I even had a case one time where I had a client developed a form of obsessive-compulsive disorder such that anytime she would have any kind of health problem at all, she would think, oh, my cancer's coming back, and she would just completely, get so consumed by that eventually her psychologist said that she couldn't function in a work environment because she was so focused on germs and so focused on any type of, ache or pain that she just couldn't work at all. So my point, I guess, is that if you've gone through one of these difficult medical procedure or processes where you've had strong medications or you've even had surgery, maybe where you've been under anesthetic and you're noticing you don't remember things, you can't think as clearly as you used to be able to think, those are limitations. And what happens is in a Social Security context, we can identify those limitations and use them to basically eliminate categories of jobs. For example, you may have done work with numbers in the past where maybe it was a skilled or semi-skilled job. Now, because of these mental health limitations or cognitive limitations, you can only do unskilled work, and that could perhaps make you eligible for a grid rule where you can be found disabled even if you can do certain types of physical things, or it could eliminate categories of jobs in terms of past work, or it could be enough to disable you totally, completely. So the point is, if you've got these things that are happening to you, that have happened to you, talk to me, talk to your lawyer about them, so that we can make sure they're properly addressed and explored, so that when we get to a hearing, we can make sure the judge understands that not only do you have this maybe primary medical issue, but you've got this secondary problem that could create some significant work limitations and maybe greatly contribute to a finding of disabled for you in your disability case. I hope this has been helpful. Again, my name is Jonathan Ginsberg. Any questions, please let me know.